Well, Senator, I'm looking at the one that he sent to us, the copy he sent, which he said was passed by the Senate on the 19th of February this year. I'm looking at the one you also sent, saying that's the appropriate version. But while you were reading from the one you said was passed, the appropriate one, I was reading from the one he sent, and the clauses appear to be the same.
No, to be?
They appear to be the same thing in text. And as a matter of fact, let me even read from the one he sent, which you say is the wrong one. 48, 1A. Let me go to B.
Yeah.
Because we've just seen 1A. B says that the consent clause may be waived for medical investigations and treatment in emergency cases. And C, in accordance with prescribed protocols by the appropriate authority.
Yes.
This is the same thing that is written in the one you have, isn't it?
No, yes, some of the things may be there, but there are certain clauses that he quoted there that is not the one we passed.
No, this is the one you sent. This is the one you sent.
No, this is right.
That clause might be waived.
Yes. No, there's nothing wrong with that. That is a specific. No, look at the case.
For medical investigation.
Listen, if you have to read along. Subject to the provision in 53. A person shall not remove tissue, blood, or blood products from the body of another living person for any purpose except that the consent clause may be waived for medical investigation and treatment in emergency cases. The reason is this. Somebody comes in, let's assume, has had an accident, is unconscious, and you have to save the life of the person. At that time, you are talking about removing blood from that person, and the person is unconscious, cannot give that consent, but you need to save the life.
That's in an emergency case.
That's why I say in an emergency case.
So that's a waiver.
When the consent, when you can have a waiver.
What about the medical investigation?
Maybe wait for medical. No, the medical investigation is for the emergency case. It's not read separately. That the consent clause may be waived for medical investigation and treatment. It's a combined word in emergency cases.
So they cannot look at the medical investigation all by itself?
No, it's only an emergency case. The qualifying clause there, it's only in an emergency case. It's not. It's a qualifying clause. That is the way laws are drafted.
Okay. While we're looking at the clause by clause of this law, let's look at the bigger picture here, so to speak. The minister in this bill is given enormous powers. So who checks the minister?
No, the minister, I don't see the enormous powers given in this place.
He's the chairman of the National Council.
Yes, he's the chairman of the National Council, but that council, let me just say, he is the chairman of the National Council, but the National Council is made up of, at the moment now, it is made up of about 39 persons. The minister is there, the 36 state commissioners are there, the permanent secretary. So there's no way he's going to stand alone against the rest of the country. Everybody has a voting right. But he's chairman of council, and ordinarily so. He should be chairman of council because he's the minister. The other ones are commissioners. There has to be a chairman.
Okay,
but when they discuss national issues and national health, there must be a consensus amongst them.
But I see Oluwaseun saying, please, a prescribed manner is almost vague because we now say, it says it's written, understood, and informed consent of the person. I think it's thinking, is there no way, is there any such thing as Interpretation Act for this one? They want it properly spelled out what the prescribed manner is.
A prescribed manner implies, it's not vague. A prescribed manner means it has to be prescribed by regulation. It has to be prescribed by regulation. That's why they use the language prescribed. It's a legislative language at this point in time. A prescribed manner means by regulation. That means there will be further regulation to decide what to be done. It's like when we're talking about transplant issues, beyond the fact that we have made provisions that restricts certain things or confirms that certain things must be done before transplantation, there's also provided for that there must be normal protocols. That's when we're talking about prescribing. There must be protocols for the purpose of transplantation, just as you have protocols when it comes to research. You make provisions for research, but there must be protocols that must be met for the purpose of research. And then the committees will go on, make recommendation, it comes to the minister, then the minister standing in council agrees on what should be the protocols on any of these situations. That's the way it is. So it is there. If you go to interpretation clause, it is clearly stated. Prescribed means prescribed by regulation made under Section 59.
All right. Okay, that's how far we can go. Although there are so many questions about the pharmacist on this, but unfortunately we can't look at that. Maybe we'll find another time to bring Senator back in and look at more matters on this. But I want to thank you for coming on, Senator. I find your call as the chairman of the Senate Committee on Health, and we've been talking about the National Health Bill, and maybe we'll find a way to forward some of the response to you so that
why not?
we could just clear some of the issues from them.
We'll be glad to make Nigerians understand the bill. It's been discussed at public hearing, and the final version passed. We would like to talk about it to Nigerians again and again. It is the best for our country because today we are working under very loose conditions. We don't have appropriate regulation. We don't have appropriate management of the healthcare service. And now we are put it into law. So at least there is a control process. It is in order to save Nigerians. It is for the good of Nigerians. It is for the good of their health.